All right, folks, so let's answer a question that I got via email since I'm so popular now. So this is this is a great compliment to me, but this guy writes, this is a student in Italy. He writes, "Dear Dr. Abdolghani, first of all, I would like to thank you for the very informative videos you have on YouTube. They are of utmost help. I'm currently a second-year med student in Italy. Our program is 6 years long. I'm looking forward to taking the USMLE with the prospect of doing my residency in the United States, possibly in radiology." Smart. So I checked your guides and your experience with the USMLE, and you really emphasized the importance and core role that question banks had for you. However, for me, the problem is that starting with question banks doesn't seem suitable. Firstly, our program is not tailored towards taking the USMLE. And secondly, I feel like I still lack the foundational knowledge to start using question banks. Do you see a way for me to balance schoolwork while preparing myself for the USMLE? And do you think there are any resources that I could use as my foundation before starting the question banks? So thanks for reaching out. I've definitely reached out in my study journey to professors, authors of textbooks, and other people who've taken exams, and definitely my seniors. And I think it's important to reach out. So it's a 6-year program, so I don't know when you're going to take the USMLE. But the way to prepare for the USMLE is the same. It's universal. The thing that you mentioned about your curriculum, there is no curriculum, no med school curriculum prepares for the USMLE, I don't think. I think some of them might advertise that they do. Some of them might do NBMEs as your final exams for each preclinical course or for your clerkships. That was the case in our school, in my school in Florida. But definitely in your first 2 years, unfortunately, the curriculum is what the professor wants to teach. I've had neurology where I've been learning about like ferrets and stuff, which has nothing to do with USMLE in my in-house exams. And I remember I was so frustrated about it that I was inefficiently studying for other things because I was just so angry that I was wasting time on. So now you lack the foundation to start using question banks. So I think Dan the Man MD, the revered Dan the Man said it right in the other video that I mentioned that you guys should watch. But the first thing to do for preparing for USMLE is to do your best in your preclinical years as a med student. To learn the foundations and the core of physiology, anatomy, pharmacology, the biochemistry that's important for medicine, and then pathology, and then diagnosis and treatment. So there's nothing wrong with doing good on your in-house exams. And I don't think that, maybe there are cases. I definitely did put in a lot of effort towards my in-house exams. And I did see that there was some benefit to that for the USMLE. I only saw that benefit at the end of my studying. I don't know that it would have been more beneficial, that it was more beneficial to study for my in-house exams than to just do question banks and not ever go to class or anything like that. But the reality is when someone on YouTube makes a video of how to study for the USMLE, it's really isolated, the USMLE. Whereas you're applying for residency in the United States, so you're an IMG, you have a different background, and to get into residency, you need great grades in your preclinical and clinical coursework. You need a good USMLE score. You need great interview skills. You need strong recommendation letters, and likely you're going to need some research. So you can't sacrifice your in-house exams and your performance in med school so that you can perform well in the USMLE. So I would like to warn you of that. If you're just scraping by in your first 2 years of your preclinical coursework, that's going to reflect in your USMLE score, and it's going to reflect in your transcript. Now, the question is, how do you blend? Because you have to basically do a parallel curriculum, which every med student has had to do. You have to buy Pathoma, Boards and Beyond, UWorld, Amboss, whatever online, Sketchy, whatever things you value to study for the USMLE. And at the same time, you're paying tuition and studying for in-house exams. It's kind of unfair, unfortunately. So to answer your question, do I see a way for you to balance? I think the best way to balance is to consistently do some practice questions, starting with a low tier practice Q bank, and do those practice Q banks. You're going to do 2 Q banks at a time, especially in your second year of med school, or at least my second year, but my med school was only 4 years long. You do one totally random, and another one you do it by topic based on whatever you're covering that section or whatever clerkship you're on if you're in third year. So if you're in your preclinical years and you're doing neurology, on USMLE RX on AMBOSS, you can filter neurology only. And you can do that. At the same time, you should be doing another question bank, a low-tier question bank. If you're 7-8 months out of the USMLE, of taking the USMLE, that's random. Okay? So that way, you want to capture all the USMLE content that's relevant to whatever you're taking in med school at the time and learn it to your best of your ability so you can do well on your in-house exams and develop the scaffold that allows you to now go into an in-house lecture and you're not starting from zero, but you're able to just listen to the lecture and build upon your USMLE knowledge. So if you want to do well in the USMLE, my strategy when I started actually being efficient was the foundation of all my knowledge was USMLE, and then I went into my in-house exams, and I did better in my in-house exams afterwards with less effort because I knew all the neurology of the USMLE. So cranial nerves and strokes and lateral pontine, whatever. And then my professor would talk about stuff like that, and then they would talk about the nuances and the tangents and go off into low-yield topics. But because I had a foundation of neurology that was strong from my USMLE prep, I was able to quickly absorb that and cram it 3, 4, 5 days before my exam, learn whatever in-house special knowledge I needed, do well in the exam. I didn't get honors. I got a pass with commendation. We had 3 tiers: pass with commendation, and honors. I only got honors in MSK and my surgery clerkship. I never got honors in anything else. I just got passed with commendations across the board. And that wasn't my goal. My goal was to get honors, but I failed in that goal. But I'm just telling you, that was the best way that I could balance. Now you ask, do you think there are any resources that I could use as my foundation before starting the question banks? I still believe that a low-tier question bank is the best foundation for better question banks and for USMLE prep. But you could argue, you could say there is room for you if you've started a question bank and you feel like you're not making any progress. I would still continue that question bank and not give up. In parallel, I would, on the topics where you're finding that you cannot answer questions correctly, I would pick a textbook to do some reading, and you have to really time your reading and not think that I'm gonna spend the whole day reading. No, it's literally like you miss a question, you miss the same question 3, 4 times, you read about that topic. Physiology, Costanza Physiology. Dan the Man MD talks about it already. For anatomy, I used Moore's Clinical Anatomy, and then, of course, there was this classic one. I don't know if it was what it was called, but it's like your anatomy textbook from your anatomy curriculum. And that's what I would use, though, and I would also use, because you're already paying for it, okay? I would use stuff like your in-house lectures, your in-house PowerPoints to review based on topics. Hopefully your school categorizes these things by topics. I would use those things. Now, other review material. There's Pathoma, there's Sketchy. Pathoma is super critical. Definitely Pathoma is important. There's Sketchy. I'm not really a fan of Sketchy, but my friends have said it helped. Again, if you're in the review stage where you know nothing and you keep missing the same question over and over again, maybe a Sketchy video or 2 could help. You could also consider Boards and Beyond. You could do a free trial, or you could do a 1-month thing and then only watch the videos and then answer the questions and watch those videos like double speed. And you should be able to pay attention in double speed for the topics that you're missing. So, I don't have a whole list of comprehensive review because I realized early on, luckily, that the best review is practice questions. And for me, I loved, if I missed a question in UWorld or in AMBOSS, I would read about it in the Amboss library, and that like click and go feature of Amboss, it makes it so seamless. In UWorld, though, also if you miss a question, sometimes they have a link to a review article on PubMed or something like that. And as I reviewed the question that I got wrong, I would click on that review article and read the abstract quickly. So I'm talking about less than a minute outside of the UWorld platform. Because you have to set yourself a limit, because you have your map is your QBank, and when you exit your QBank, it's like Star Trek, okay? You're in uncharted space. You're in the internet, and you could be going anywhere, and you could find yourself 2 hours later. You started off with the cranial nerves, and now you're looking at, the pressure receptors in the skin of the great toe or some crazy wild thing, and that's a waste of time. So you only do 1 minute of reviewing that review article, that abstract, that was linked from UWorld. And why do I say this? Because you're paying for the question bank. The question bank is an expert, people who are tailoring the whole question thing to the USMLE, who they're studying the USMLE, you're paying for it, they're giving you a curriculum, use that curriculum, take advantage of it, use them as a guide, use them as a scaffold. Don't make your own curriculum, don't reinvent the wheel.